Welcome everyone to our virtual roundtable series. We're going to start in a minute, make sure to get everyone on, but very excited to have you here again. Thank you. Okay, I think we'll go ahead and get started here. Well, welcome everyone on behalf of the BOLD Public Health Center of Excellence on Dementia Caregiving. Thrilled to have you for our second virtual roundtable series. This is really exciting for us to host every other month in that we get to hear from states that are doing exciting work in the space of dementia caregiving and public health. And today certainly will be no exception with California. And again, I'm the director of the BOLD Public Health Center of Excellence on Dementia Caregiving. My name's Joe Gogler. I'm here at the University of Minnesota. My research is broadly focused on innovation in dementia care. We always feel it's essential to begin with the land acknowledgement and to think about the values espoused in these land acknowledgements and really reflect and think through how they align with our own work. And so the University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. To tell you a little bit about our center, I think many of you have attended our various events and activities in the past, so this probably isn't new to you. But again, our BOLD Public Health Center of Excellence on Dementia Caregiving is a CDC-funded national center that's really designed to support state, tribal, and local public health agencies across the country in developing as well as implementing their dementia caregiving focused initiatives. We do this through improving access to evidence-based programs and best practices in supporting those who care for individuals living with dementia. I think a big emphasis of our work is facilitating connections and collaboration. This roundtable series is a direct result of that, and really facilitating connections amongst public health agencies as well as other organizations. And then finally, as needed, providing technical assistance in all of the great work you're doing in, again, supporting dementia caregivers vis-a-vis your public health initiatives. So I'm going to turn it over to Elma Johnson, the BOLD PICO coordinator, and she's going to tell you more about the virtual roundtable series.
Hello, everybody. Thanks, Joe, for the intro. My name is Elma. I'm the coordinator of the BOLD Public Health Center of Excellence on Dementia Caregiving. It's so nice to see you all here. As Joe mentioned, this is our second installment of our bi-monthly series, and it's geared towards public health. And we are highlighting really stories of one state at a time and their work to advance and elevate really the work of caregivers of people with dementia in their state or in their jurisdictions. We envisioned this series as a convener in this space of dementia caregiving, this series for networking and peer learning and sharing of ideas and experience from one another. And in that, what we hope is to really build a community of practice, beginning with our BOLD public health programs and including all the other non-BOLD programs, public health agencies, and all of their collaborators in the space of dementia caregiving. So please exchange, learn, hear, listen to one another, and feel free to share your work as well. We will continue doing this series. The next one will be in 2 months in March. And to make this collaboration possible, you will see that we have made this in a meeting format, just to create that space where we can more easily connect with one another than in a webinar setting, which means that we will have just a few housekeeping rules, things to follow so we can have a productive session. Please, as you join and throughout the meeting, keep yourself on mute and turn off your camera while the panelists, our presenters today, are speaking. Later after that, please feel free to turn it back on your camera. We encourage you all, please, to display your name and your organization in Zoom. So next to your name, especially we're interested in knowing if you are joining us in representation of a public health agency. Again, we welcome the whole community here, but for example, at the end, when we have a Q&A time an opportunity for you to ask questions and maybe even respond to some. We hope to give maybe the first chance to our public health agencies. So that will really help us identify those of you in the audience who are public health agencies. So your name and your organization. In your Zoom menu, you should be seeing chat and the Q&A. All the questions that come up for the presentation today for our presenters, submit all questions in the Q&A. The chat is reserved for you to share comments, resources, links, and ideas. Maybe you decide, wow, this made me think something that Lisa and Lily might present today may make you think of another program similar in your space that you would like to share with others. So please use the chat to share resources and the Q&A for your questions. And after the presentation, we have saved about 20 to 30 minutes for conversation and to answer your questions. We will begin by answering the questions that you have submitted in the Q&A, but after that point, you may also raise your hand if you would like to speak or ask a question. So, and we will call up on you. In that case, you can unmute yourself. Use your reaction button. This is a virtual space. Believe it or not, we had minus 13 degrees in Minneapolis early this morning. So I'm so thrilled to see so many of you here in this virtual space coming together. And we will send a recording of this meeting and the presentation slides after this event. So without further, to begin, we would also like to get an idea of who all is here with us. Maya, my colleague, is going to launch a poll right now. And please tell us in what capacity you are attending this event. It should now be on your screen. We have option bold public health agencies, non-bold, community organizations and service providers that collaborate with public health agencies, for example, caregivers, people living with dementia, clinical and care professionals caring for people with dementia and their caregivers. I have some answers here still coming in, and I'll give it a couple more seconds before I share. We have about, for our presenters especially, we have about 42% of community organizations. We have 12% of bold public health agencies and 17% of non-public health agencies. So about almost 30% of public health agencies with us here today. And I am going to share results. Hopefully you can see it on your screens now. Yeah. All right. Thank you everybody for answering that first question. And without further ado, I would like to introduce you to our great speakers today, Lindley Stern and Lisa Gonzalez from the California Department of Public Health in their Alzheimer's disease program. This will be a great session. You will learn a lot. They're great. And please, Lisa, Lindley, go ahead. Welcome.
Good morning. Thanks for having us today. Good morning, everyone. My name is Lisa Gonzalez, and I'm a program lead at the Alzheimer's disease program here at the California Department of Public Health. And I have the great honor of presenting today with our section chief of the program, Ms. Lindley Stern. So if you'd like to say hi, Lindley, feel free.
Hi, everyone. It's nice to meet and see everybody's faces here.
Excellent. Thank you so much. And like Elma mentioned, today we're going to share some of our successful public health approaches related to dementia caregiving here in California. Next slide, please.
Thank you, Lisa. Okay, so thank you, buddy. Thank you, everybody, for joining today. We're really happy to present on what we're doing in California. So today, our presentation is going to focus on the following public health areas that have framed our Alzheimer's disease and related dementias work in California. Specifically, in the two areas that we're going to focus on today is policy development and assurance. My colleague Lisa Gonzalez and I will be highlighting 4 slices of the pie that frame our public health work in California. In the policy development area of the pie, we will be discussing our work related to inform, educate, empower, as well as mobilize community partnerships. For the assurance area of the pie, we will highlight our work related to assuring a competent workforce and link to providing care. Next slide, please. To understand how we got to where we are today, let's go back in time to 1984. Legislation was enacted that established the Alzheimer's disease program in 1984, and it was expanded further in 1988. The legislative mandate sought to relieve the human burden and economic cost of Alzheimer's disease and related dementias, and to assist in ultimately discovering the cause and treatment of these diseases through the creation of the Alzheimer's disease program. Funding for a statewide network of 10 California Alzheimer's disease centers, or I may refer to it as CADCs throughout the presentation, at university medical centers was established. The California Alzheimer's disease centers are dedicated to improving the quality of life of persons affected with Alzheimer's disease and their families. The California Alzheimer's disease centers were established to improve dementia healthcare delivery, provide specialized training and education to healthcare professionals, and advance the diagnosis and treatment of ADRDs. 30 years after inception, our program received the Alzheimer's Disease Research Fund, which awards grants through a competitive process to scientists in California engaged in the study of Alzheimer's disease and related dementias. So beginning in the fiscal year of 2018 to 2019, the Alzheimer's disease program received about $3 million general fund to fund research in connection with Alzheimer's disease and related dementias and their caregivers. In the fiscal year of 2019 to 2020, the Alzheimer's disease program received $3 million from Alzheimer's disease and related dementias, with a focus on women and communities of color, along with our first ever round of funding for community-led interventions through the Healthy Brain Initiative through our local health departments. Next slide, please. A core tenet of the Alzheimer's disease program is the awareness of the gender, racial, and ethnic disparities that exist in both Alzheimer's prevalence and representation in clinical studies, specifically women, Black Americans, and Hispanic Americans, which begs the need for more diversity in dementia research. This understanding puts a larger health equity lens in focus for our work, and it is embedded in our programmatic efforts to address Alzheimer's disease and related dementias in California. The Alzheimer's disease program's mission is to build awareness of brain health and empower California communities to address Alzheimer's disease and related dementias. Our program is funded into three main areas: have prevention or risk reduction, research, and clinical. Our programmatic goals for prevention and risk reduction include improving the quality of life of aging Californians by promoting awareness of brain health and Alzheimer's disease and related dementias risk factors, eliminating health disparities related to Alzheimer's disease and related dementias in California while improving health equity, improving the quality of life of Californians living with Alzheimer's disease and for the caregivers of these persons, and lastly, improving policy, systems, and environmental change interventions that promote brain health and Alzheimer's disease and related dementias risk reduction strategies. For research, our programmatic goals include continuing to build on the existing breadth of research to address the multifaceted nature of Alzheimer's disease and related dementias and their disparate impact on communities throughout California, and increasing the understanding of the causes, prevention, care, and treatment of Alzheimer's disease and related dementias through research to drive policy and programmatic changes. For clinical, our programmatic goals include providing a patient-centered care model that instills a strong coordination of care and builds the foundation for providers and caregivers to provide equitable quality healthcare statewide, and ultimately improving the health status of Californians living with the disease. Next slide, please. Here is an illustration of just how vast the social and economic burden of Alzheimer's disease is here in California. Alzheimer's disease will continue to be a significant public health issue to address. So it presents a large burden. It's the third leading cause of death in the state as compared to 6 nationally. More individuals with Alzheimer's disease live in California than any other state. It is estimated that over 500,000 California adults aged 65 and older have been diagnosed with Alzheimer's disease. However, less than half of affected Californians have been diagnosed or informed of their condition. Age is the greatest risk factor for Alzheimer's disease, and California has the second longest life expectancy in the nation at 81 years, placing the state as a whole at greater risk. Therefore, the impact is enormous. California is home to the largest number of family caregivers at 1.2 million in the nation. The cost of caregiving for someone with Alzheimer's is staggering. The economic cost of unpaid care is estimated to be worth $18 billion annually in California, and billions of Medi-Cal, which is California's Medicaid program, dollars are spent annually. In 2020, Medicaid costs of caring for individuals with Alzheimer's was estimated at $4.2 billion, with a 25% increase in costs expected by 2025. So that gives you a good overarching view of what we're battling here in California. So next slide, please. This is a huge issue or public health issue that impacts across groups. So taking a closer look at the numbers, by 2030, the number of Californians with Alzheimer's disease will double to nearly 1.2 million. Across all ethnicities or races captured, there will be an estimated increase in Alzheimer's disease prevalence. No matter what the ethnicity, 1 in 6 California baby boomers will have Alzheimer's disease. And as a state, we have to have additional resources and infrastructure in place at the California Alzheimer's Disease Centers for our research and at the community level. Next slide, please. Two important documents serve as the guide for how California reaches their goals through the Alzheimer's Disease Program and our partnerships. The California Master Plan of Aging, or for Aging, outlines 5 bold goals, 23 strategies, and 100+ action-ready initiatives to build a California for all ages by 2030. It also includes a data dashboard for aging to measure progress and a local playbook to drive partnership to help meet these goals together. The master plan calls on all California communities to build a California for all ages. For older Californians currently living through the many different stages of the second half of life, and for younger generations who can expect to live longer lives than their elders, and for communities of all ages, if family, friends, neighbors, coworkers, and caregivers surrounding older adults. It serves as a strategic plan to address Alzheimer's disease and related dementias in California. The 2021 Master Plan for Aging is pictured here in the slide on your left, and a 2023 version was recently released. On your right, you see an image of our path forward. So in 2019, Governor Gavin Newsom formed the Task Force on Alzheimer's Disease Prevention, Preparedness, and the Path Forward to develop recommendations on how California can prevent and prepare for the growing number of Alzheimer's cases and forge a path forward for families. Led by Maria Shriver, she's our former First Lady of California and a longtime advocate for women and people living with Alzheimer's. The task force is made up of a diverse group of consumers, caregivers, neuroscientists, researchers, healthcare providers, innovators, family members, education system, private sector leaders, and media professionals. So it's a pretty diverse group. In 2020, this task force released the final 10 recommendations for Alzheimer's prevention, preparedness, and the path forward. This serves as a roadmap and implementation plan on how California proposes to address Alzheimer's disease prevention. Next slide, please. As previously mentioned, California continues to fund Alzheimer's disease centers throughout the state. These centers serve as the backbone of the Alzheimer's disease program. California has been a national leader in Alzheimer's disease research, and since 1985, the state has invested more than $90 million in the California Alzheimer's disease centers and has leveraged the funds to raise more than $544 million in federal and private research money. The 10 California Alzheimer's disease centers at university medical centers provide diagnostic and treatment services, professional training for medical residents, postdoc fellows, nurses, interns, and medical students, and community education, such as caregiver training and support. Each CADC receives about $281,000 each year in state general fund revenue in support of their diagnostic and education mandate. Many CADCs, or our California Alzheimer's Disease Centers, are also federally qualified Alzheimer's research centers. So that would be UC Davis, University of California, San Francisco, Stanford, University of California, Los Angeles, University of California, Irvine, and University of California, San Diego. The centers submit progress reporting highlights to the Alzheimer's disease program, and their year-end training and education reporting will be posted on our website. We will include a link to our Alzheimer's disease program website at the end of the presentation. Looking at the map, you can see all of our 10 centers are across California. So Northern, Central, and Southern California are captured. We have University of California, Davis at Sacramento. We have University of California, Davis at East Bay. We have University of California, San Francisco, University of California, San Francisco at Fresno. And then we have Stanford University, University of California, Los Angeles, University of Southern California, Rancho Los Amigos. We have University of Southern California in Los Angeles, University of California, Irvine, and University of California in San Diego. Next slide, please.
All right, thank you for the overview of our clinical work, Lindley. Next, I want to talk a little bit about some of our community programming to highlight for you all. And I have the pleasure of working on this firsthand here at the Department of Public Health. And I want to present just some of our work on the Healthy Brain Initiative that promotes our risk reduction work and general awareness of Alzheimer's disease and related dementias. And some of you, it sounds like from the poll, may be familiar with this initiative in your states. So apologies if some of this is background knowledge that you already know. But for those of you that don't know a little bit about the Healthy Brain Initiative, this will be a good introduction slide. So we're excited that this has gained a lot of momentum in the last year or two or three, now that we're in 2023. So I want to go ahead and highlight a few key areas of this initiative. And it was honestly our first time that we were funded to provide local grants to health departments for community-led projects. So that was a big piece for us back in 2019, 2020. And as most of you might be familiar with, the purpose of the Healthy Brain Initiative is to advance cognitive health as an integral component of public health by implementing CDC's Healthy Brain Initiative roadmap at the local level. So in our pilot phase of this initiative, which occurred between June of 2020 through June of 2022, we were able to fund 6 local health departments that you see here on our map, which include Los Angeles, Placer, Sacramento, San Diego, Santa Clara, and Shasta counties. And each of their projects began in June of 2020. And as I mentioned, they just wrapped up this past fiscal year in June of 2022. And I need to highlight here before I proceed with any of the juicy highlights for this initiative, that each of the projects showed great perseverance because they obviously experienced a lot of significant project implementation challenges due to the COVID-19 pandemic. When they wrote these applications, COVID was not a thing. And then all of a sudden, they get awarded, and all of a sudden COVID is happening. So all the work plans that they presented and submitted as applications, kind of went out the window or had to be reworked to make it happen and meet the needs of the community. So I just have such kudos to share for them for being able to pivot and lean into us for any support to actually implement these 2-year projects. So shout out to all of them on the hard work of doing that when they didn't think that they were going to have to initially. And I do want to highlight that in this past fiscal year, we received additional funding for our next phase of the Healthy Brain Initiative. So what we're going to do with that is fund the 6 pilot projects that you see here on your screen to help them continue their successful programs, as well as fund at least 6 or more additional local health departments through a competitive RFA process to just continue building out our initiative here in California and make it even more successful and impactful. So this is kind of a broad overview of what the numbers look like, the years look like, they're 2-year cycles. And then in my next slide in just a moment, I'll share a little bit of our successful outcomes from the first initiative or first round of Healthy Brain Initiative funding. So I wanted to give this overview because it just kind of touches on a few key points. And I can move to our next slide, please. Okay, so here we have for you our first poll question, and we're just curious to know, since we have a lot of folks from various organizations who are here, we'd like to get a sense of how familiar you may be with the Healthy Brain Initiative. So we're wondering if you've implemented an HBI program in your state. So we've got a couple options. Yes, you may have, no, you might be planning to, or maybe you're not familiar with it at all. So just curious before we move to our next slides. Ooh. Okay.
I don't know if you're able to see, Lisa and Lindley, the results. Yeah. I can share them on the screen here for everybody. I just want to give everyone just a second to answer, and I think we're ready. Almost there.
Yeah, take your time.
Okay, I think we're good. Oh.
Oh, all right. So the majority at 53% are not familiar with the Healthy Brain Initiative, and 36% have implemented or are currently implementing, and a small percentage have not but are planning to. That's great. Thank you so much for filling that out for us. It really helps us to understand who's all in the room. So I'm really glad I covered a little bit of some background. I'll continue to sprinkle that in as I talk about our Healthy Brain Initiative work. Thank you so much for your help on that, Paul, Elma, and Maya. Okay, great. We can move to our next slide. Okay, so feeding into a little bit of the background piece of what the Healthy Brain Initiative is, I want to just provide a high-level overview of the 4 overarching goals of the initiative that we've been working towards here in California. And they include monitoring and evaluating the health status of populations to identify and resolve health issues, while also assessing the effectiveness, accessibility, and quality of healthcare services and programs available in their counties. Second, educating and empowering community members about brain health and cognitive decline. Next, we have the goal of developing policies and mobilizing partnerships to support health efforts and find solutions. And lastly, the 4th goal is to assure a competent workforce of public health and healthcare professionals who are knowledgeable and reliable sources of brain health information and ways to inform those that they serve, including caregivers. So these are the large goals that anyone implementing a Healthy Brain Initiative program is striving for. And it is really cool that a couple of the ones we work towards here in Healthy Brain Initiative that we are going to highlight today are also parts of your wheel or pie, as Lindley referenced. So I wanted to just put a snapshot here that it's really cool that a lot of these things just naturally align in public health. So you'll notice that I'm going to be talking a little bit about educating and empowering and developing policies and mobilizing partnerships specifically, which I've highlighted in blue, but is also highlighted in the previous image in green. So I'm really excited that that just naturally fits so well together. So going back to how we take this HBI roadmap framework and translate it into actual work happening at the local level, what happened is that these roadmap goals were then broken down into specific work plan objectives and activities. And for the 6 recent pilot projects, their local roadmaps or work plans included a combination of a few required objectives in addition to unique objectives that they determined would meet the needs of their communities the best. So I've highlighted in blue, like I said, some of the goals that our projects were really able to interact with caregivers the most. And in our next slide, I'll highlight a few of their successful accomplishments, but those are the 2 that I know we can pull out for today in our discussion around caregivers and caregiver support. Next slide, please. Okay, so as I mentioned, we just wrapped up our first round with this initiative, our first cohort of pilot projects, and they were very successful in not only just actually implementing an HBI program for the first time, but really doing their best to, address any challenges, communicate the challenges to us, and work together to just keep moving forward. I can't say that enough. Any public health program that was running around the same time encountered the same challenges. So I just want to make sure I preface all of these beautiful outcomes I'm about to share. I'm so impressed because of the landscape of how those happened. So I do want to take a look at some of the collective successes that were achieved across the 6 pilot projects. And like we saw on the previous slide, the 4 overarching goals, we can successfully say that each of the 6 county health departments were able to meet the initiative's goal, and we're very, very proud of them. So these projects were able to successfully begin integrating cognitive health into their county-wide public health initiatives. And we found that they were most successful when they were able to properly assess their county and then tailor those work plans to address their unique community's needs, as well as having meaningful partners at the table along the way. Meaningful, cannot stress that word enough, that was very, very much a huge piece of the success that they had. So on this slide, I've got a brief snapshot of some of the amazing overall outcomes of the initiative. And I'll go through each of these a little bit more in detail. So for the monitoring and an evaluating goal, our projects were able to successfully develop 28 informational materials, which included a community needs assessment, which was integral into informing their work plan. And they also developed several caregiver and patient education materials. For our educate and empower goal, This one we're really excited about. Our projects were able to place 101 media campaign assets overall, mostly via digital, radio, and print media, which were used to build awareness of Alzheimer's disease and related dementias and brain health. And they had great success in subcontracting and partnering with their local Alzheimer's Association chapters to implement these campaigns. And I do want to take a moment to give a shout out to Santa Clara County, who was one of our pilot projects and is on the call today. So hi, Santa Clara. They were successfully able to translate their media campaigns into into Spanish, Chinese, and Vietnamese languages to reach their diverse communities in that county. And they also generated 3.7 million social media impressions, which was the most of our entire cohort. So they definitely really leaned into this education piece and met the needs the best they could, and really reached a lot of folks. So very, very impressive. And our projects also provided educational training opportunities for over 11,000 participants, including patients and family caregivers. So I know that's a big piece of what we wanted to highlight today. And then next, for the develop policies and mobilize partnerships goal, it's very exciting because in just 2 years, these projects were able to collaborate with 103 partners, most of which were new, which is wonderful because that's what they found was the need. We got to build those partnerships and get everyone at the table. And these partners included various organizations like local nonprofits, schools, governmental agencies and departments, libraries, faith-based organizations, medical groups, hospitals, clinics, local transit planning agencies, enforcement agencies, and so on. And the really cool thing here is that projects reported that most of their partnerships would continue after the completion of their initial round of funding. So that's really nice that we were able to build in a sustainable piece to demonstrate that what we did with the pilot projects were successful and meaningful. And we want to continue working together with these folks to just create more change and more impact. So that was very, very exciting for us to see happening. And then, of course, our last goal with assuring a competent workforce, one of the really big outcomes we saw here was that projects were able to conduct 91 training sessions for over 5,000 professional individuals and groups, including physicians, nurses, social workers, and first responders. So that was a key piece of just kind of tying in how can we get folks diagnosed and in to see professionals sooner? How can we make that process a little more seamless? So from the pilot initiative, we've gleaned so many lessons learned and best practices that will continue to inform and improve the programs and the initiatives' effectiveness. So these outcomes here are just a small snapshot of what transpired, but I wanted to just try to be as concise as possible. And we hope to expand on these successes and outcomes and replicate them in our next round of funding. Like I mentioned, these folks here that did all this beautiful work are going to continue their projects for the next 2 years, and then we will fund 6 additional, or at least 6 additional counties to hopefully build on these lessons learned and learn from the pilots and create an even bigger impact here in the state. So we're very excited about that. And we are ready for our next slide, please. Okay, so this is just my second poll question for the group. And I'm just personally curious how everyone kind of addresses caregiver education and support strategies in their counties. And this doesn't have to be Healthy Brain Initiative specifically. This could just be, public health programming or community programming in general. If anyone reaches that population, how do you do that? How do you provide support? Perfect. We've got training, support groups, media ads, website, and print resources. Maybe some of you do all of those, which I'm very impressed if you do. Oh, cool. Oh, wow. I figure since this is a caregiver call that this would be really robust. Okay, perfect. Oh, that's excellent.
Oh, sorry, Lisa. I'll share the results with everyone. Please let me know if you're seeing them on the screen. I'll just give it a second more. Okay, I think we are good.
Oh, perfect. Wow. I love it. So 47%, all of the above strategies they include. That's very impressive. A lot of you do provide support groups and training and share website or print resources, and a smaller majority do media ads. That's awesome. Thank you so much for just giving me that insight. It's always nice to see how folks are reaching the population of caregivers. Okay, great. We can end that poll. Okay, and I am ready for our next slide, please.
Thank you, Lisa. In addition to our Healthy Brain Initiative work, our program focuses on our newly funded projects. As part of the 2021 Budget Act, the program was provided an initial $34 million to support the implementation of 5 out of the 10 final recommendations of the Governor's Task Force on Alzheimer's Disease Prevention, Preparedness, and the Path Forward presented to Governor Newsom in November of 2020. They align with the emerging master plan for aging by promoting public health's commitment to improving health outcomes and reducing disparities in California. The 5 recommendations funded through the Budget Act include cutting-edge research, Alzheimer's disease public awareness campaign, California caregiver training and certification program, dementia-friendly communities, and California statewide standards of dementia care. Next slide, please. So beginning in fiscal year of 2018, the Alzheimer's disease program received $3 million general fund to fund research in connection with Alzheimer's disease and related dementias and their caregivers. In fiscal year 2019, the Alzheimer's disease program received $3 million for Alzheimer's disease research with a focus on women and communities of color. And in 2022, we funded 7 new research grantees for a total of over $8.7 million, encompassing several areas, including early diagnosis and detection to health disparities in caregiving. So taking that health equity lens that is enmeshed in the framework of the Alzheimer's disease program, this cycle of research funding has had a focus on understanding and addressing the greater prevalence of dementia in women and communities of color, and also expanding research to include populations historically underrepresented in research, including the LGBTQ+ community, American Indian and Alaska Native, the Native Hawaiian or other Pacific Islander, and isolated rural communities. Next slide, please.
And we're excited to announce that we are going to build awareness of Alzheimer's disease and related dementias across California through our first ever public awareness media campaign. We've awarded an $8.5 million contract to our selected media agency, who will be beginning with us in March of this year. And their role is to educate the public on the signs and symptoms of ADRDs and using targeted outreach to connect with populations at greater risk, those who are diagnosed, and also their caregivers. So this campaign that we're going to be planning here soon will be an integrated campaign across paid, earned, owned, social media, everything, and will be multilingual, multicultural, and intergenerational, and mainly designed to shift public perceptions and reduce the social stigma around ADRDs. So we're very, very excited that we were able to select a wonderful media agency who's going to do such great work for us. And then basically what they end up creating for us, any of the content, any of the images and messages, we will be sharing that with our local health jurisdictions, our clinical groups, the CADCs you heard about, everyone that we work with that we're already funded with. This will also be trickled down to them in meaningful bite-sized ways so they can continue spreading the word through our programming, which is really exciting. And of course, catching folks that aren't even aware of us or aware of ADRDs. So it's really going to capture a lot of folks all at the same time. And we're very, very excited about it. Next slide, please. And then here, I just wanted to highlight one of our unique strategies for executing social media as an education component here at the state. How we go about it is, through our national organization partnerships, we go ahead and take a look at our promotional calendar, what's coming up, what we want to highlight at the state level, and we adapt those messages from various partners, and then go ahead and send our draft messages to our Office of Communications, who run our social media platforms, which include Instagram and Facebook. So we have a really strong partnership there to make sure what we are presenting is accurate and leans into our partnerships and builds on any momentum already happening within the various partners and states across the country. So it's exciting that we have this already in place where we have a relationship and we can actually get messages and content posted on those social media websites. And we usually do that in English and in Spanish. So the exciting part here is they not only post on the public health department's social media pages, but what they do is also take those approved messages and build those into an online social media toolkit that is also posted on our website. I have those links here on these slides as well. And that basically is available to anyone and everyone who's running any kind of Alzheimer's disease and related dementia program that want to build in social media to their programming. So it's great. Once we get everything out on the platforms, and then we also have kind of a little clearinghouse of those messages and content for folks to run with. So again, for our partners that we already work with, it's a really great tool to just say, here's what we've got, use it and share it as widely as you can so that we can continue to just correlate everything together and make sure we're making as much of an impact and reach as possible. So we wanted to highlight that here for you today. And again, those links will be available. I can pop it in the chat, or they will also be available on your slides. So the next, this slide here just features a quick snapshot of November, which was National Family Caregivers Month, which I'm sure a lot of you are already aware. And we're excited. Our next big promotion will be in March around Brain Health Month. So that's when maybe if you check our social media sites or our webpage, you'll see that we've updated a lot of good information around March. So yeah, I wanted to definitely highlight that piece because that's a big piece of what's been growing here at our program. And next slide, please.
Thank you, Lisa. So for California's statewide standards of dementia care, there are two components to the 3.8 million in funding. So that's including 1.7 million available for designing a statewide standards of dementia care model in collaboration with the California Department of Healthcare Services and local community partners. The focus is public health risk reduction and providing post-diagnosis resources for providers. The second part of this funding is for predictive analytics using a risk calculator with the goals of improving screening protocols for Alzheimer's disease and related dementias and reducing health disparities in Alzheimer's and dementia screening and care using the latest data integration and technology. We have about 2.1 million in funding available for this work, and we are in the very early phases of selecting a contractor. So we haven't implemented this yet, but this is something coming on the forefront for 2023. Next slide, please. Okay, so what everybody's waiting for, caregiver training program. For our caregiver training and certification program, we have funding of 3.4 million available for the development of our caregiver training and certification program. This will elevate the care in communities throughout California by expanding access to evidence-based dementia-related education and training for caregivers, with a specific focus on unpaid family caregivers. We have already begun the contracting process with two partners between Northern and Southern California who are partnering with community organizations for developing the program. The important takeaways from this program is knowing that caregiving looks different in different communities, whether it be racial and ethnic, the stage of disease, or how long you've been a caregiver. Providing training options allows room to capture and support the spectrum of experiences. The first option that one of our partners is developing has an individual caregiver focus. That is a pick and play for users based off where you are at in your caregiving journey. And the second option has a community caregiver focus. So an idea of joining a cohort or a community of fellow caregivers with shared experience. Our partners work with the communities at a local level to understand and be able to meet the specific needs of the populations they serve. By building community-based partnerships that facilitate collaboration, it ensures that work is not being duplicated in different areas of the state, but rather builds cross-linkages across California to provide various training options to meet the differing needs of caregivers on their caregiver journey. Next slide, please. So now I'd like to hear a little bit more about what your state is doing and if you have knowledge of what your state is doing regarding a caregiver training program. So please answer the poll in the chat. So does your state have a caregiver training program? There's currently planning or no knowledge that a caregiver training program exists. Wow, this is pretty evenly split. Looking right now. About Gonna wait till some more answers come in.
I think almost all answers are in. Should I end the poll?
Sure.
All right.
So it was a very close call among all three. So about 35% mentioned that you currently have a caregiver training program that's being implemented in your state. And I was really close at 33%, you're in the planning phases. And then about 32% don't have a caregiver training program in their state that exists. So that's really interesting to hear. And thank you for sharing. I think this is a great platform to learn about what other states are doing, other jurisdictions. So we'd love to continue this conversation. So next slide, please.
Okay, so focusing on prevention or reducing the risk of developing dementia within local communities. Our next area of programming that we want to highlight is that we've awarded one local health department here in California, that is Sacramento County, to partner with the Blue Zones organizations on a dementia-friendly communities project. And through this pilot project, they will be working to promote the core tenets of optimizing the environment that build policies to increase physical activity, healthy and whole food options, socializing, reducing smoking and alcohol use, while increasing volunteerism and improving mental health in the aging population. So the funding for this pilot project will ultimately be used to create long-term place-based interventions that support healthy behaviors that can potentially reduce healthcare costs and expand lifespans and improve the quality of life. So we're excited for this pilot project. It has just begun this past couple of months, and this will be funded through June of 2024. So a short pilot project, but really what we're hoping comes from this is a great thorough community needs assessment of what do we need to do here in this county to make it more dementia friendly. And through the assessment process, an action plan and implementation plan will be developed so that the county has sort of a roadmap of its own to go ahead and proceed with what can we do to create all the interventions that will make us successful and make us certified as a Blue Zone or dementia friendly community. So we're very excited that that's another recent addition to our community programming landscape. And next slide, please.
Yeah, so as we start to wrap this up, maintaining and building strong partnerships is something that we continue to prioritize as we collaborate at the state level or statewide level across departments and stakeholders to ensure that we are all working smarter and not harder to advance the field through our efforts. So our key partners include the California Department of Aging, the California Department of Healthcare Services, California Health and Human Services, Alzheimer's Disease and Related Disorders Advisory Committee. I know these are a mouthful. Alzheimer's Association, Caregiver Resources Center, our area agencies on aging, which is part of the California Department of Aging, and the Centers for Disease Control and Prevention. Next slide, please. I briefly wanted to speak about our statewide partners at Dementia Care Aware. So this is a statewide program in California that trains primary care providers to properly screen their patients and refer to a specialist for diagnostic and treatment components of care. We want you to all please keep in mind that Dementia Care Aware is funded through our Department of Healthcare Services. So that's the important linkage that we have across statewide departments. And this is not funded through the Department of Public Health. Therefore, we do not fund this work or work directly on it. So please feel free to go to their website. I believe I put it in the chat box. Their website is also listed on the slide. So to learn more about their work and what they're doing throughout California. Next slide, please. So in summary, the work being done in California through the Alzheimer's disease program is highlighted in this dementia continuum of care diagram, where we see our programmatic work meeting the needs of the communities we serve. Through the Healthy Brain Initiative, dementia-friendly communities, on the public awareness campaign, we have a strong public health focus on prevention and risk reduction across populations in California. As we continue through the continuum, our state partners at the Department of Healthcare Services target initial screening of patients in a primary care setting. And then post-screening, our California Alzheimer's disease centers fill the role of diagnostic care and post-diagnosis treatment for patients. And at the core of this continuum is caregiver support. This is an essential component of a patient's journey and care. Our caregiver training program serves to provide that additional support for the variety of experiences that a caregiver may be at in their dementia caregiving journey. Next slide, please.
Okay, so here we have just kind of a brief list of some additional resources that once you get a copy of the slides, you'll be able to click into these links here. But of course, we want to highlight our broad public-facing website, which has a lot of background data on what you just heard related to CADCs, Healthy Brain Initiative projects, research projects, and upcoming funding opportunities as well. So this is a great hub to come and get lots of information. The facts and figures of California report, which is kind of our big data surveillance report, is also on that webpage, but it has its own link here in case you would like to take a peek at all the juicy data. And then a couple of items that Lindley also highlighted in some of her slides are the recommendations from the governor's task force, as well as the master plan for aging that we promote and go ahead and align our work with. So those are links that are available for you all to take a peek at if you would like to do so. And then our next slide is just basically leading us into any questions you all might have. And if you're not familiar already, we do have an inbox that we can go ahead and submit, that you can go ahead and submit questions to if you'd like after today. If you want to schedule any follow-up calls to talk about anything further, this is the best way to reach us. And this kind of ends the presentation portion. And I'll go ahead and turn it over to Lindley and Elma for our Q&A session.
Thank you.
Thank
Lisa.
you. I just have to say thank you. This was such a great overview. I mean, from prevention to risk reduction to working with caregivers, from the clinical to the community to the public health setting, your work covers it all. And it's such a comprehensive body of work in the space of dementia in your state. So thank you so much. We have a few questions in the Q&A. We can start with those. And then as Lisa said, if you have additional questions you would like to answer one, or if you have something you want to share with everyone for sure, please raise your hand. I have a couple of questions if we ever get time to those, but Lindley, should we maybe start with what we have in the Q&A?
Yes. So the first question is from Yvonne. I'm a caregiver in San Diego County. Where can I obtain HBI resources, training, and see the media campaigns? And who are the community partners? So I think we partially addressed that through the presentation. Our media campaign, or statewide media campaign, hasn't been launched yet. You'll be seeing that later in 2023. For HBI resources and training, we put this in the chat box a link to our website. We have a Healthy Brain Initiative tab. If you go to our Alzheimer's disease program website, and you'll be able to click, learn more about the initiative, what we're doing, and it also provide further resources to the CDC and that overview roadmap and what we use to locally implement through our counties. So all those different resources. And then we also provided the communications toolkit as a link in the slides. If you, do we provide that here in the meeting chat? That might be something.
Yeah, I'm gonna add it right here. I just threw in the Healthy Brain Initiative page on our website here in California. So if anyone wants to talk more about San Diego or any resources there, feel free to look at this website that shows you a little bit about San Diego and what they did with the pilot project, and go ahead and send us an email and we can connect you with that Healthy Brain Initiative county who's just kind of getting their work up and running again. So that would be amazing to connect you directly with the San Diego Public Health Department, who's got this program already existing.
I would also say for community partners, we also fund one of our CADCs, or California Alzheimer's Disease Centers, is the University of California, San Diego. So if you go on our webpage, maybe Lisa, you can link that. We also have connection to all our CADCs and you can connect more information there. I would also, Lisa, if you could put in our California Department of Aging. So they have those different resources and community partners specifically for our aging population throughout California. And you can be able to access through their website some more information. So I think that should be helpful.
There are a couple of questions related to the caregiver training program as well in our chat. Lindley, maybe you can answer it. When will the caregiver training program be available in California? And I do have a related question on this topic as well to follow on.
So we're currently working with the University of California, Irvine and University of California, San Francisco at Fresno, and they're already working on this. They're already working with community partners through Northern California and Southern California to do this work. So I would suggest reaching out to us and we can connect you with them to the work that they're doing. And we're working on our end to kind of continue to launch our partnerships together, but they're already starting the work and doing the work. So if you reach out to us, we can connect you with them.
I was curious, as you were speaking about the caregiver training and certification program, is there a specific evidence-based intervention or evidence-based program that is state endorsed or that is emerging among all the best practices that you would like, that the state promotes, or no?
Specifically for dementia caregiving?
Yes, yeah.
I would say that through our partnerships with the CADCs and through UCI and University of California, San Francisco, Fresno, we are partnering with them as experts in the field. I wouldn't say there's a specific one that we're endorsing and we put on the front right now.
Mm-hmm. Okay.
For best practice. If that answers your question, you can email me more. I can provide you more information.
Yeah, I was just wondering, some state public health agencies might have a certain program that they promote or others don't, and I was just curious. Okay. Another question we have is, how does dementia-friendly communities intersect with dementia-friendly America?
So for dementia-friendly communities, we really are working with Sacramento County, as Lisa mentioned, and supporting their partnership with Blue Zones. I wouldn't say that we have any active intersection with Dementia-Friendly America at this point for how we are implementing dementia-friendly communities.
I wonder if there's anybody on this call who might be able to answer this question from Dementia-Friendly America, perhaps. Please raise your hand or let us know. Okay.
And I will say that once we've gone through the pilot project, I'm sure a lot of things will come to light with additional partners that we might want to work with and consider, like, roundtables like this, where if other folks are doing it, connecting with other states. I think a lot of that will probably happen naturally as we get going and doing the assessments. We'll realize, what do we need to pull from that other states have done? So that, I think that naturally will fall into place with just kind of seeing what the national landscape is for folks who might have done this before or might be in the same boat of just starting to think about things like that.
Can I, this is Nirmala from Oregon. Can I just answer that question very briefly?
Yes, please, Nirmala.
So we have, in Oregon, we have both, dementia friendly cities, and we have a Blue Zone. And so just from my experience, I think that was the question, right?
The question, the relationship between dementia-friendly communities and dementia-friendly America.
Oh, I'm sorry. I thought between Blue Zones and that. I will keep quiet.
Oh, thank you, Nirmala. Don't worry.
We love to hear what other states are doing. So please don't be shy in sharing your experiences in Oregon or wherever you're located at. I'm sorry.
So in Oregon, yes, this is Nirmala. We are about to launch a project very much like your your project about training primary care physicians. We are going to launch it in March, which is a 2-year dementia screening in primary care, where our goals are very similar. So we are going to recruit 30 clinics, both rural and urban, to actually train. So it's a quality improvement project where we'll be using people called practice facilitators who will be embedded in the clinics to beyond the education and training. We're also looking at how do you hardwire this into your clinic. So we are looking at creating workflows, how can providers be more efficient in terms of their EHRs, with prompts. So that project we are going to launch in March. And even as we speak, we are seeking funding for replicating the Georgia Memory Net project in Oregon. So, and we're doing many other things around dementia, but I just wanted to highlight those two.
Wow, that's amazing.
Yeah, thank you for sharing. Hopefully Oregon will present next. We'll be in attendance for that. We'd love to hear more. I want to keep going with the questions. I also saw Michelle Johnson, who is our collaborator at the California Department of Aging, put the link to the website in the chat, and then also the latest master plan on aging. So if you guys want to check that out, I think those are really important. And hi, Michelle. Continuing down the questions, Yvonne had, in dementia-friendly communities, what does place-based mean? Lisa, do you want to answer this one?
Yeah, I think that's basically a concept of, we want to make sure that when folks walk out the door, they've got a community and an environment, a built environment, a physical environment that really addresses aging healthily and feeling empowered that you can make healthy decisions based on what you see every day in your interactions. So place-based is just related to where you're going every day, whether that's to church, the grocery store, to the park to get some physical activity in. Maybe you're really involved at the library or have a nice social group already in existence. So just kind of thinking through, when you walk out the door as someone who's starting to age and wanting to do that in the most successful and healthy way, how can we make sure that interventions and partnerships are built at the ground level innately, just in a natural way, so that we think through it as a whole person community model of what are folks interacting with every day, and how can we interact and make a meaningful impact to make folks age healthily based on where they're at every day in their lives. So that's the best way I can describe it. It's just really simple, and we really want to get to the heart of meeting people where they are at.
Thank you.
And then Lindley, I don't see this. This was actually a question or comment rather posted in the chat. It's not really in the Q&A, but it's on the topic, also from Nirmala, on the topic of inclusive language. And I was thinking if you would have any comments or anything to share about any lessons learned along the way in your public health awareness effort and your education campaign. Inclusive language, whether it's for the different types of dementias, right? Sources of dementia, and then also language to reach different communities as well.
Sorry, I'm just scrolling back right now in the chat. I see. Yes, the term we use is ADRD, and that stands for Alzheimer's disease and related dementias. And that's the term that we use to be inclusive of the other dementias as well. And kind of using a broad stroke term, because we are the Alzheimer's disease program, but we do focus on Alzheimer's disease and related dementias. So within that umbrella.
Mm-hmm.
I see John Bowers had a question, might have missed a mention. Does California have an ADRD state plan? When was it last updated? We can go back in the presentation, but earlier there we captured our California's core plan. So we have the master plan on aging, which is through the California Department of Aging, which serves as a strategic plan to address Alzheimer's disease and related dementias in California. And Michelle Johnston put in the link, the latest master plan on aging that was released this past year. And then we also have the task force on the Alzheimer's disease prevention, preparedness, and our path forward. And it gives the final 10 recommendations. And it provides our roadmap and implementation plan for how we propose to address Alzheimer's disease prevention in the state. And we can actually
link that one.
Yeah, we can link that. Sorry. We have a lot of links that we probably need to add in here. and then we have a last comment from Diana Miller. Just a comment might be confusing for us who are dementia-friendly community through US aging. We understand that that can be confusing, and we appreciate your comment. We use dementia-friendly communities as something that relates to our specific final 10 recommendations for the Alzheimer's prevention, preparedness, and the path forward, and it hits one of the recommendations that uses the term dementia-friendly communities. So that's kind of where it comes from in our use and application of it in the state of California, but we understand and we thank you for your comment.
There is one more question from Tia Delaney. It's specific to California. Tia Delaney here. I'm the DEI director for the Alzheimer's Association here in Southern California. Are there funds being allocated toward caregiver rescue programs within the LA areas and other cities that are in dire need of this type of support?
Sorry, I missed that one scrolling down. Hi, Tia. In terms of caregiver respite programs within the LA area, we currently don't have funds specifically being allocated towards caregiver respite programs within the Los Angeles area, but if you email us, we can connect with you further about programs that we are funding in the area and how to connect you with our Healthy Brain Initiative, Los Angeles County, also our California Alzheimer's Disease Centers, and kind of connect what work's being done. But I have nothing to add more on that right now.
Yeah, thank you. Thank you for offering. Tia, please feel free, as Lindley said, to reach out to the team and they can provide more answers. I do have a question. I don't see any others in the Q&A right now. But I do have a question. As you were speaking about your HBI, Healthy Brain Initiative work, and within the section of assuring competent workforce, I am wondering if you're able to tell us a little bit about how, if and how California uses community health workers. They might be known as promotores, promotoras, in different communities might even receive other terms, but if you're using community health workers in any way, as part of the dementia and dementia caregiving efforts, and is there any training that's being developed or added to their curriculum? I know that there's been a lot of interest in this particular role to support public health efforts in dementia and dementia caregiving specifically.
Yeah, I would jump in on that one and just kind of say that's not specifically anything that we require of the Healthy Brain Initiative work right now, but that is naturally one of the best practices of how to reach a community and build trust, with just having those champions, those promotoras, whatever you want to call them, the leaders in the community that can really mobilize folks and get folks listening to the messages, talking about it, sharing resources. So I think that's something that is occurring with our pilot projects and will continue to probably happen, but we don't specifically have a call out for community health workers, but we do know that that's just a best practice overall. And how do we create a community program and get it to the community in various ways? So that's something that I know that they do, but it's not a requirement of the program. It's just something that naturally kind of evolves. It would be nice to maybe build in more of a robust piece around that, just to really hone in on the fact that that's something that's really important. And, you know, in future reports and evaluation reports of these types of initiatives, it would be a great call out, but it is something that they have identified as a best practice along with coalition building. I think that's another big community engagement piece that helps, because having the right partners at the table includes those community health workers that are trusted in the community, whether that's caregivers, whether that's folks with lived experience, or just folks that are really connected to the community, as well as those clinical experts or providers that can speak to the disease itself, the signs and symptoms. And I think that's a great way that when we build our new coalitions with the new round of funding, that we make sure folks are aware that is the best practice, and we would love to see them including more folks who are sort of those community leaders who have a lot of influence as well.
Thank you. Thank you. That the importance of coalition building, it is really including a very diverse set of stakeholders on the table. It was also a topic that we discussed in our previous installment of the series, and specifically with Mississippi. And I believe, if I remember correctly, they actually asked the audience what are some of the lessons learned or best practices all of you here on the call have learned along the way, how to engage diverse caregivers, people living with dementia, and diverse stakeholders in your coalitions. So any thoughts, insight about how to facilitate this network building are welcome. And somebody also asked Yvonne, will all the links be available after the Zoom meeting? Yes, we are going to capture the chat from this meeting and send it along in our follow-up email along with the slides. And I think Tia Delaney has her hand up. Tia, would you like to unmute yourself?
Hi, everyone. And let me just make sure I have a faulty Wi-Fi connection today. So what's your question related to more ways to meet caregiver opportunities you have available?
Oh, Tia, we cannot hear you.
Yeah, it's coming in and out.
Yes, I have a weird connection. I'll just send you the information in the chat. Can you hear me now?
Yeah, let's try it one more way verbally, and if not, you can maybe submit it in the Q&A. We can answer it there for sure.
Okay, I was responding to your question. Was your question around ways to engage with other organizations of your programs?
Sorry, Tia, we cannot hear you.
It's okay.
Please share it in the chat. Share it with everybody, even if it's in writing. I'm sorry, it's going to be a little bit more of a time to write, but we value your input. Monica Lukashevich, I hope I pronounced that correctly. You have your hands up.
Close enough, Monica. Thank you so much for hosting this very rich conversation. I'm working out of Mesa, Arizona under a grant. I'm an occupational therapist. We're implementing an evidence-based program called COPE from Drexel. And one of the things that we're seeking to do under our grant is to engage more of the IDD population, which is kind of what I thought of when someone asked that question about engaging with more diverse, just more diversity and equity in general. And something that we just tried last week actually was leaning into some of the relationships of places like we have an Arizona Caregiver Coalition, Pima Council on Aging, just some like local places where we met some people and built some great relationships. And we ended up just tossing out the idea to have a community huddle, and of 20 people invited, ranging from like a local neurologist to professors at occupational therapy universities. We had 12 people show up. And what was really interesting was showing up, having the huddle and just asking some open-ended questions, saying where we were at with the grant, but really just showing up to build that village. And the turnout was really incredible. And the response was really positive. So I know that there's so many different types of diversity to try to include. And we also recently found just really saying yes and talking to people who show up, because we also offer a memory cafe, and we recently had a family from Egypt. So they speak Arabic, but in just reaching out to resources, we've been able to actually help them and identified like a UTI in the home. But in just saying yes and saying, we'll get back to you, like we don't know yet, but we'll do some research and come back, has been really helpful for us.
That's great. Thank you for sharing. I think that's an important thing to keep in mind as we build collaboration, because we don't have all the answers, but we know how we can get more information and build those connections and collaborate. So thank you for sharing that.
Thank you, Monica. Thank you. Are there any other questions, any other comments, or even like ideas of programs that those of you in the audience are aware of in your own states, communities that you would like to share with Lindley and Lisa, get their input on? This is our platform for that connection.
Elma, this is Nirmala. I did raise my hand. I don't know
Oh.
whether you saw it.
Oh, I didn't. Sorry. Go
Okay.
ahead. Nirmala.
Okay, so we have implemented 988 in Oregon, like many other states, including California, I think. And we are training our crisis workforce. And one of the curriculum topics is older adults in crisis. And we are really looking at dementia. And then we also widely do CIT training, crisis intervention training with law enforcement. And one of the topics is responding to older adults in crisis. And a big part of it is dementia. So I just wanted to focus on the 988 part, that we are definitely looking at that as a competency for the crisis workforce with our population aging, very rapidly in Oregon. So I just wanted to bring that up. Thank you.
Thank you, Nirmala. And this makes me think of a webinar we had on disaster preparedness response and follow-up that we hosted a couple months ago. And as part of that is just increasing number of communities and states really looking at the need to develop plans, disaster crisis response plans, really for working with people who live with dementia and their families, family caregivers as well. Thank you. Thank you for bringing that up. Thank you for sharing.
Hi, good afternoon. My name is Danielle Riley. I am with the City of Chicago's Department of Family and Support Services. Yes, it's a mouthful. Essentially, I represent our Senior Services Division, which is, our agency on aging, I would say, for the Chicago area. I did want to share, on top of our work with communities or, neighborhoods in Chicago, being able to support them as they work to become dementia friendly. We are, as our agency on aging, we were awarded a grant through the Administration for Community Living back a few years ago for the Alzheimer's Disease Program Initiative. And through that, we have been providing the Savvy Caregiver evidence-based program, so training for caregivers. We've provided the Advanced Savvy Caregiver program as well as part of that. We also recently implemented the Stress Busting program for family caregivers last summer. Through our Alzheimer's Disease Program Initiative, aside from Savvy Caregiver Training, which was the main proponent, we have a brain health program that the Administration for Community Living, CDC, so it was a combined effort, but we have been providing topics every other month that, are more focused on informing the general public, of course, and awareness around just how to maintain a healthy brain. So we've had a number of different talks around social connectedness and health, traumatic brain injury, memory and managing memory, just basic brain health awareness. And also a huge part of our grant, we work with one of the geriatric workforce enhancement programs here locally through the University of Illinois, Chicago, and our Age Friendly Commission. And what they did was created a training program called the Dementia Friendly Buildings. And so we've taken that and we've trained hundreds of buildings throughout Chicago. There were thousands and thousands of units that were identified where adults are aging in place. And what they did was design this curriculum to be able to provide training to maybe their resident service coordinators, because it's HUD housing or housing that individuals are Section 8 vouchers, or it could be condo associations, or just senior independent living, you name it. But the idea was to really be able to train those individuals that might come into contact with individuals who are aging in place, so that they can be aware of the signs and symptoms of dementia. Maybe so and so was not paying their rent, or they're exhibiting odd behaviors, or however, and they would be able to know what that looks like, be able to implement a plan within their own maybe property management companies, or however, or how to identify, have conversations with the family, what next steps might be. So those are some of the things that we've been doing through our initiative here locally in the Chicago area.
Thank you, Danielle. And great work. It sounds breadth of work and a lot of collaborations. Please, if there's any links or any pages you would like to share with us here, please do.
I most certainly will. I know that the training that our geriatric workforce, one of 3 actually, that UIC develops with us, it is now an actual module. So it's a self-directed learning module. So I will put the link in the chat, and people can go on it and take it in their own time. But it really is designed to, again, assist those who come into contact. We're really hoping that it'll reach, it might be a doorman in a building, or however, any of those individuals that, again, are really coming into contact with folks that just might be looking confused, or however, exhibiting signs and symptoms. So I'll definitely pop that in the chat. Thank you.
Thank you. And thank you for mentioning the collaboration with the Geriatric Workforce Enhancement Program. That has also been a topic that we are interested in our center, and see what opportunities for collaboration might there be between public health and higher education institutions, and the programs they have to train the workforce as well. So I will definitely be looking at that. I might be reaching back to you.
Thank you.
I don't know if we have any questions in the chat, Lisa, Lindley, or would you like, I see that Monica raised her hand. I will let you decide how we spend the next few minutes together.
Oh, any raised hands? People can come off mute. I saw Monica come raise your hand as well if she'd like to come off mute.
Sure. Just really quick, in speaking of resources and kind of that higher education option too, if anyone lives in a state or a city where there are doctoral occupational therapy programs, students must complete a capstone project. And it's an incredible idea to collaborate. You do not have to have an occupational therapist at your site. It's 14 weeks, 40 hours of work doing evidence-based practice for your organization. So if you reach out to the director of any doctoral OT program or occupational therapy program in your area, they would probably absolutely love to know what you're doing and possibly help you if you would like that support. And it's free.
Thank you, Monica. Thank you so much. Andrea? Andrea Robert, you have your hand up.
Yes. Can you guys hear me?
Yes, we can.
Okay, so great. So my name is Andrea Robert, and I really enjoy hearing the last speaker in regards to some community outreach that they're doing in certain areas where people of color are, because when you talk about the initiative, there's a lot of great initiative, but I noticed there was not a lot of response in regards to exactly what people are doing in these communities. So I really like that they engaged in where people are living in Section 8 or HUD housing, reaching the community, because that's where the people are. And so, like I said, there's a lot of great initiative. I am proud to say that I'm part of the California initiative, but I would like to see more outreach effort in regards to these communities, because we hear that the initiative and the grants are going to these communities in regard to diversity, people of color, but we're not hearing the exact outreach effort that they're making. So I would love to hear more about the exact efforts and initiative that are going into these community instead of just hearing that grant funding are going towards these community, but the work is not being done. And that's important to me because I am a person of color and my condition may or may not progress. I have MCI. I live single with it. And I have lived experience, and I look to see for initiative that's going to be important to me and the people in my community. And I'm talking all underserved community, because we have been talking about this for a very long time, but you're not hearing the response in regards to these efforts going into these communities. So I would really, really like to see more outreach effort. And I know it can be done because I have done it single-handedly in the past. And so, I like also the concept in regards to community outreach workers or community workers to be able to be trained to kind of help some of the healthcare, population or the professionals help in making these initiatives come to reality. And so, like I said, I am so happy to be part of California, but I would like to see more work being done, action being done in these communities. So thank you.
Thank you, Andrea. I agree. And now that we've got like a pilot project that's been implemented, we've got those lessons learned, and that's something we've also identified as how can we, throughout the course of the project, make sure that folks are being reached, the priority populations, the communities of color that we know based on all the research and based on the roadmaps goals are those that need to be that we need to be interacting with the most. So that's something that we plan to build out with these next rounds of funding, more so hitting on specifically what are you doing to address those inequities. Those types of conversations are usually captured within our reporting internally within the program to make sure that their programs are being as effective and inclusive as possible. So one of our goals is to do a good job of capturing those reports collectively, like the slide I showed of some of the outcomes, though that is a small snapshot of the Healthy Brain Initiative evaluation report that's being written. And it takes time to write those things. You have to gather all of the information, the data of what projects we're able to do. But once it's finalized, it will be posted on our website on that Healthy Brain Initiative webpage. And that'll be at least one way where we can communicate back to the general public what we're doing to address those inequities and continue to build out our program in a way that keeps health equity at the forefront and engaging the right folks, in addition to our coalition building and just making sure now that we understand a little bit more of the landscape, who's not here, who do we need to include moving forward, and how do we do that outreach? So I know they have a little bit, they've been able to do that so far with the pilots, but that's something we want to empower them and prepare them to do even more so now that they've got a little experience under their belt. So I just appreciate that comment, and I agree that's a big goal of ours.
I also wanted to add to health equity is so important and what we want to focus on, and we want it to be an integral component of what we do. So I do appreciate that comment, and also want to say for our California Alzheimer's disease centers, that's something that we're working on and improving, and how we really reach the communities that need the care the most and building out the access in the areas that they do serve. So that's something that we're continuing to work with them to build out as they move forward with their work. And then another thing also with our public awareness campaign, we're also very aware of the communities that are getting diagnosed the least, that have the least access to care. So that's really going to be an important component of our public awareness campaign, and the medias that that are coming out. It's going to target those communities and get those conversations going. And I also want to know, this is so important to us, and I don't want there to be a message out there that we're not listening and not seeing that, because there are a lot of things that we are working on to continue to build out that communication and those connections. And as we continue to fund more counties throughout California, we are targeting areas that have communities of the most need, and really how do we build out those efforts and the initiatives within those groups. Also with our research grants, we're really focused on funding out the research that is looking at the communities of greatest need and that are the most underrepresented in research. So that's an important thing. And we will also be coming out with our research portfolio and what the funded research we're actually doing and what that looks like, so we can disseminate it out to the public. They can access it on our website and learn more about that. I think there's a lot of maybe misconnections on how we get the information out there. And I just want to say, we appreciate what you're saying. We totally wholeheartedly support that as well. And I hope you know that we are working on to continuing to address that and be better at communicating that message. So thank you.
Thank you, Lily. Thank you, Lisa. I'm going to briefly add in the few seconds we have left, is that I have the honor of actually knowing Andrea Roberts. She is on our center's stakeholder engagement advisory group, and always has such great observations, comments. She's a very strong advocate for the voices and the experience of our BIPOC communities, and always has great ideas and great suggestions. So I really encourage you to connect if you're able to. So we are at time, actually. I hope. Thank you so much, Lisa and Lindley, for sharing your great work and being open to answering the questions. And for you who are still in the audience, thank you for being here and for making this a learning community, helping us build that as we go along and we learn from one another. More of these conversations to learn about each other's work is what we need, really, to elevate and the work of and support our caregivers and our families. Thank you. In the chat will be saved. It will be emailed out to everybody along with the slides. And please, the contact information for Lindley and Lisa is here if you have any follow-up questions or comments for them. Lindley, Lisa, any last words?
Lisa, I'll let you go first.
I was just going to say thank you so much for everyone that attended today and were interactive and engaging and just willing to share what you're all doing. I know this is a learning collaborative and a really great series that Elma and Maya have put on for us, and we were able to really learn a lot, not only share with what we're doing, but just kind of learning from you all has been really helpful for me as one of our program leads. So I look forward to connecting with anyone after today, and welcome any questions. I know I put our shared email inbox in the chat. That's the best way to get to us. It kind of pools all of our questions in one place. That way we can respond to them as fast as possible and connect you to the right folks that we work with here in California if need be. So I wanted to just say that, and thank you for having me. I really enjoyed it.
Yeah, I wanted to echo Lisa's thoughts. I'm just really thankful to have the opportunity to share California's story and the work that we're doing here and hear everybody's feedback, get comments, and just connect with more people. There's so much more work to be done, and we realize that. And we're really proud of the work that we've done, but we also see what we need to do, where we need to focus our work moving into the next horizon. So we appreciate everybody's time, and please feel free to reach out. We love the connection, collaboration, and it's great. So thank you.
Thank you, California Department of Public Health. I hope this is just first opportunity and we'll have more to collaborate in the future. Thank you.
Thank you.
Bye, everybody.
Take care. Have a good day.